I'm Graham, I'm 57, and my objective is to see my children grow older.
Hi, my name's Alison, I'm 55, and one of my goals is to be a grandparent.
My name is Ron, I'm age 71, and I intend to enjoy my life for a long time to come.
August 2010, I felt a lump on the side of my head. No pain with it at all, I just found a lump when I was washing my hair. So I saw my GP and he wasn't sure, so he referred me to a plastic surgery who saw me and said very promptly, this is a melanoma and it's got to come out next week. So he ordered an operation to remove the primer from behind my ear the following week. So he then referred me on to an oncologist who put on a couple of scans, CT scan, PET scan and so on, to see if there was any other obvious. And there wasn't, there was no signs anywhere else, which was fine. Until about late November that year, so a couple of months later, I found another soreness and lump behind my ear where the original tumour was. That was admitted and pathology again, and it was melanoma again.
Well, I had, for about 18 months beforehand, been told the lesion was a BCC. So eventually my husband said, look, you need to get this looked at. He was sick of it bleeding. It was on my back. So I went and had day surgery, had it cut out, and then it came back as a melanoma. Called back the next day after the operation to see the surgeon, and that's when he told us that it was a melanoma. The next day I was scheduled to have a wide excision done, so more surgery. It all happened so quickly, I didn't have time. I was too busy thinking of the worst to think about what I should be what I should find out, what information I needed.
Originally, there were various lumps removed from my upper body by a cosmetic surgeon. I was having frequent checks, and over a period of 10 to 15 years, a couple of those turned out to be melanomas, and I understood from the pathology reports they were totally removed, excised. After I noticed these numerous lumps in my neck in February of this year, subsequent to x-rays, I discovered that I had a serious diagnosis of metastasised melanomas on both sides of my neck. I certainly got a shock, and I had thoughts of maybe not seeing the year out and so forth, which was fairly scary. And I was annoyed with myself for not giving the lumps a priority earlier. I thought I probably was a typical male and thought I was okay.
After I had the second operation, I then started to research more on the internet, and you quickly found out what were the reputable sites and what weren't. So I then started to gain some more information, and I realised that the diagnosis was pretty bad at that point, and I was still waiting on the scan results to come back, so there was all that anxiety.
A lot of my treatment, there wasn't a long debate about, there weren't too many options. So treatment was fairly straightforward, very helpful to have as much information about the treatment process, but relatively straightforward because there wasn't a lot of options. Do we go this way, do we go that way, do we take this drug, do we have this surgery, those sorts of things. They were all fairly straightforward. So talking to the professionals was helpful. It confirmed what I probably knew anyway. As I said, my knowledge was reasonable about my cancer. So to confirm it with 1, 2, 3 professionals along the way through treatment was very reassuring. and confirmed where I thought we were headed anyway.
The first decision to make was to have a wide local excision. So then what they do there is they cut a larger amount of skin away to make sure that there's no melanoma left. With people who've had the type of melanoma that I had, they often do a sentinel lymph node biopsy. However, I was advised not to have it, and I took that advice. I then since found out that I should have had it, but I had to move on from there. So after the second surgery, this wide excision, it was just, in terms of my physical being, it was just recuperation and then onto a surveillance schedule thereafter.
Started dealing with the people at the Alfred. I tended to go back there weekly, if not more, and it seemed that each time we went, the diagnosis became more and more serious. In fact, one of the early reports I was given was that my particular cancer was amongst the 5% of most difficult cases to have a positive outcome from. So I realised how serious it was, and there was some time before I had the option of having surgery, but major surgery was recommended, and I didn't hesitate to embark on that journey. I was dealing mainly with one specialist, but during a period of weeks when I had various tests, MRIs, PET scans and the like, I did get some response from other specialists, but basically after being introduced to the surgeon that specialises in my type of treatment, I basically took his advice and booked him in as soon as possible.
What I wish now is that I had been given more time between the two surgeries, and that is something I would highly recommend to people. You're not going to die the next day. You can, a week's grace is going to be okay, and that would have given me some time to do some more research and to ask some more questions, to speak to my doctor again.
For the consultations at the Alfred prior to surgery, I took my partner, Deb, who was there. Well, she was a great support emotionally. She was very compassionate for me, and I took it there also as a memory aid, because the information I was getting was verbal, and I didn't want to be taking notes myself, because I wanted to concentrate on what I was being told. During the few weeks prior to surgery, when I was going to the Alfred regularly, I was very confident with their abilities and professionalism. In fact, what they tended to do was run various tests and consult in the morning, and then they'd invite me to come back in the afternoon after the team of specialists had had a conference and discuss my case, being radiologists and surgeons and various other experts. So the fact that my case was being discussed by the best available experts gave me confidence in the treatment path.
So my oncologist referred me to Peter Mac in town, where I had a lymphadenectomy. There was a lymph node that had manifested itself in melanoma, but it was only one, and it wasn't deemed to be needing radiology at the time, which was fine. Back into the regular CT scans and so on again. And then 6 months later, so it was now May, June 2011, and another one had turned up exactly the same. Back into Peter Mac again, yet another lymphadenectomy. So it was about September I started radiotherapy. I came out of the radiotherapy in October, and I then had a lump feeling in my my stomach, near my abdominal. The radiologist wasn't really sure what it was, so I went off for another pathology, and this occasion was deemed to be melanoma again. So in another few months, I'd turned up at this stage, not in a lymph node, it was in my torso. Off for another PET scan, 4 torsos had actually turned up.
So my treatment going forward after the surgery was to have surveillance checkups. So I started doing those. But however, after doing a lot of after settling down after the initial diagnosis and the initial surgery, I did a lot of research, and I realised that this surveillance schedule, the checkup plan that had been given to me, wasn't as good as I thought it could be, and there were other hospitals offering a better surveillance follow-up plan. So I decided to seek a second opinion, and that was a little bit daunting because you always worry that the doctor's going to say no or get upset, but I persevered and it was fine. You know, I think asking for a second opinion is run-of-the-mill for these doctors. They don't mind at all.
Since my major surgery in April of this year, I understood the initial outcome was that they had removed all the tumours in my neck. They actually took out 54 lymph glands and 2 surface parotid glands. But pathology after the surgery did reveal that there was still some cancer in my neck, so I had further consultations at the Alfred with radiologists and oncologists and so forth. The treatment recommended after that by my oncologist was to endeavour to qualify for a trial of a medical trial with 2 immunotherapy drugs. And I started treatment in August with a cocktail of immunotherapy drugs. They were 3 weeks apart, and and there was a 6-week break at one stage. But by the 7th of December of this year, I was actually told I was in full remission from the cancer, which was the best Christmas present I've ever had.
My clinical trials have become everything to me. As I said before, I became metastatic in November 2011 when the melanoma had spread and it turned up in my torso, a good distance away from the primary. So surgery was no longer a long-term option, and my oncologist then introduced me to a drug trial. Things that happened very quickly for 12 months. If this brought me another 12, 18 months where things were stable, that was good. That was 5 years ago, and I'm still here. That BRAF MEK inhibitor drugs that I've been on through the Austin have been remarkable. As I said, 5 years later, I've had a couple of hiccups in my brain. I've had a couple of tumours that have occurred over that time, but they have been treatable.
The doctor that I then started seeing, he was a very kind and compassionate man. He was calm. He just said, this is what we'll do. He laid out a plan. He gave me the reasons why. And he said, so I'll see you every 4 months. And then at each of those visits, you can have nodal ultrasounds. Because remember, I hadn't had my lymph nodes checked through the second surgery. So he said, well, you'll see me every 4 months, we'll have nodal ultrasounds, and then every year we'll do a CT PET scan. So having read all the literature, this was perfect. This is what I wanted to have. Having the nodal ultrasounds every 4 months is anxiety producing because you do worry each time if it's going to come back normal. A lot of cancer patients refer to that time as prior to having the scan as anxiety, worrying and thinking the worst and planning for the worst. For me, the worst time is when I have my annual CT PET scan, and my anxiety levels about that pretty much go through the roof.
In addition, family and friends, in terms of support, whilst I was going through this journey, I did find the Cancer Council helpful. I read some of their booklets on diet and various aspects of the journey, including advice on intimacy and family relationships and so forth. I also rang the Cancer Council helpline for some advice, which, to be honest, I'm a bit fuzzy on what it was about, but I remember making the call and following up on the recommendations.
I was having real stress, I think. I didn't know it at the time, but after my first brain tumour occurred, the surgery that followed was very successful, very good. I had some radiotherapy, very good. But every time I had scans coming due again, my headaches would start to rise. And when they were clear, the headaches would go away. So I sort of sat back and thought, well, there's no second tumour there, so I'm creating a lot of this myself. So I went to see some psychologist help to see how I could manage that a little bit better, because it was clearly I was creating a lot of these problems myself. So how did I manage those? And I spent 6-8 months, I suppose, on a regular basis talking to the psychologists, and they were very helpful. They gave me a whole bunch of different options about ways I could handle those sorts of things. As it happens, the thing that worked best for me was that the physical work that I could do. Now, the drugs that I'm on, fatigue, is something that limits me, but just simple as walking my dog every day for an hour was worthwhile. It was a blank time because my dog didn't talk to me much. He just liked to go for a walk. It just gave me time to think things through, reject, look forward, look back, process the naughty bits, process the good bits, have time to think it through, and I'd come home from a walk around the block much more clearly than I walked away.
You can't afford to be a passive passenger. You cannot afford to be a passenger when you are diagnosed with cancer. I understand that people are shocked and upset when they're first diagnosed, but eventually you have to see what's out there and decide what you want to do. And that's why time is so important. That's what I mentioned earlier. You do have to develop some trust in doctors. I mean, they are the experts, but by the same token, you still need to question what they're doing and do some research as well. I had to find out as much as I could to keep, for peace of mind. That was my way of coping. The other thing was I would, after each of my visits with my doctor, I would start writing down questions as a result of my research. So by the time I went to see him every 4 months, we had a couple of A4 pages to get through. But that was good. He didn't mind at all. And sometimes it was the dumb questions that I asked that really put the jigsaw together for me. That was really good. So I say, don't ever be afraid to ask what you might consider a dumb question. Really, I know everyone says there's no such thing as one. There really isn't. Because, like I said, it can just help things gel for you and give you a better understanding.
One of the attitudes I've had right from the very early days was not to second guess what might or might not be around the corner. That was certainly where my head was early days, was worrying about ABC happening or not happening. And then when you got there, you started to worry about things happening or not happening. It just seemed to me to get you into dark places and confused places. So from a very early day, very early day, I tried to take it one day at a time. Just approach things as they came If there were good days, there were good days. There were bad days, there were days that weren't so hot. And that's true of life, whether you're unwell or not.
When I was first diagnosed, my husband, he actually researched and found this support organisation called Melanoma Patients Australia. Soon after, I rang their helpline, and I was then speaking to a lovely lady who had herself had melanoma, and so she knew exactly how I felt, where I was coming from. I started to feel not as alone, which was great, because you have all these emotions going on inside. So to speak to someone who knew what I was going through was really good.
The big differences between when I was first diagnosed and where I sit now are phenomenal. I had a mindset after I got the first diagnosis that I wanted to stay positive and look after myself, make the most of every possibility. But I was fearful that I may not see the year out, and now to have seen the year out and be in a remission stage, it's just, to me, it's just an amazing journey, and it's a credit to the specialists involved, to the miracle drugs in particular. But I also like to think it's a credit to my friends that have given me great support, and also to some extent a credit to myself in terms of how I've approached it mentally, to try to be as positive as possible and to look after my body.
Have a good talk to your doctor. Try and get as much information as you can. Write down questions or information as you go, or have your support person do that for you. Then go home and have a think about it, talk to your friends and family, decide then if this is the best course of action. If you're concerned, go and get organise to go and get a second opinion. And then thirdly, I'd definitely seek out a support organisation so you can speak to people who've already been down that road and can offer you some advice.